We already see the slide. Okay, please.
Very well. Can you hear me okay as well?
Yes.
It's audible.
Okay, good morning. It is a pleasure to be here today. My name is Ana Pinto Alexander, and I am the Health Interiors Director for HKS globally. I would like to today, I didn't understand what your professor said, but I kind of follow what he was saying through the diagrams. And I would like to speak to you today about the softer side of evidence-based design and about the softest side of how we design hospitals to really inspire the humans to heal, not only for your body that you're going to heal, but also your mind and your spirit. But before we do that, I wanted to give you a little bit of a background of how we are now here today. And it happens in the 1980s, and you always hear the power of one person. In this case was Angelica Theodore. Angelica experienced the hospital from two different occasions. That was in the 1980s. One, she was herself a patient, and how she felt that they were speaking to her, the doctors, they were speaking of her case like she wasn't there. It was very institutionalized. And then the second time she was there when her father was ill, and she became more of the patient, excuse me? And she became more of the patient advocate. And so what happened is that Angelica Theodore's husband was also one board member of this hospital. And then they took these experiences to the hospital administration, and they starting to make changes into the hospital of how they treated patients, that they were human beings who you were being treated. And they created an organization that is called Plane Tree. And Plane Tree, it is where the first time of healing environments, the word of healing environments came out of. And the goal of this healing environment, it is to have a place where there is a grow spiritually, where there is also a place for the staff to be taken care of, and where is also a place where the patient advocate or family members are being taken care of. And then we evolved to the 1990s when Play Tree really flourished, and they developed more goals, and then they realized the importance of the built environment that plays a role in your healing process. And it's what we call the architectural and interior design, how important it is to be conducive to your health. We also understood how important was to empower the patients and the importance of supporting, having places for the family and friends, and that they still continue with the social support. And overall, they wanted to also create healthy communities. Then we move forward again. This is actually kind of going parallel, that we evidence-based design came to the front. This was in the 1985, and evidence-based design is very much based like evidence-based medicine. You know, we all right now are following how we are coming out with this new medicine, and the evidence that it has and the data it collects. Well, evidence-based design, it is the same principles. We are collecting data through experiments to find out if the solutions that we do in the built environment are working or not. And evidence-based design could be from improving operation efficiencies, or maybe reducing the medication that you need, or simply a better experience for you to heal. So in today's conversation, I'm going to walk you just through a few points. We do not have the time to go through every point, what it entitles of evidence-based design. So we're going to speak of connections to nature, the exposure to our work, how this also helps with wayfinding and the importance to find a clear wayfinding, acoustical control, and more than anything else in today's mind, infection control, and how then as designers, we choreograph the experience. How do we choreograph, a place where people feel comfortable, and then you evoke trust and confidence. And the importance that how to create these environments of being healthy and also supported environments for the people and the occupants of the environment. So first we go into connection to nature. Everyone, we all feel, if I ask most of you, where would you feel the best when you feel more at ease? I guarantee you 90% of ourselves will say somewhere outdoors. Could be the mountains, somebody could be the ocean or the beach, and they're just different for everyone. And so this is the same way that the connection to nature actually makes you feel better, just being exposed to the natural light. And especially one of the most important thing is the lighting and especially the lighting filtration into the space. So the benefits of the light that it brings, not only it brings you when you're exposed to the sun, it just makes you feel happier. And you have heard the expression, I'm blue, and when it's a cloudy day, you feel maybe not so happy. And it is because all is the light, is what the light is doing. And also, how can we mimic in the internal, in the interior environments, the circadian rhythm? A circadian rhythm is our natural rhythm. And before we woke up in the morning and we went to bed at night when it was all dark. But right now we do have electricity. And of course we have our phone devices who keep us awake all night long, and they don't allow us to sleep and rest. So when there were studies and evidence-based design about the importance of the connection to the daylight. Dr. Aldrich made some exercises where they put in cardiology patients, some that they were exposed to a daylight and natural light, and some that they were not. And they noticed that the patients that they were exposed to the daylight, they were less depressed, they reduced the length of stays, they also reduced sometimes medication, and particularly staff was less fatigued. More benefits about the light, it is and how to render the realistic color pattern. And when you know a little bit about lighting, it has a cool effect and a warm effect. Ideally, it is a color realistic, like you are outdoors, is around 35 Kelvin. And so it is important that in the built environment, we try to achieve that. And we do it between natural lighting and artificial lighting. Exposure to our work. The art is not only a way that we bring nature inside of the environment. As you know, in a healthcare environments, we're not allowed to bring plants into the patient unit because they do have little bugs, and they carry micro cosmos that it just brings, and is not, and people are allergic to it. So a good way to bring art and biophilia into the environment is through the artwork and through patternings. Art is not only a picture, it could be in many ways expressed. And it is important to have artwork for not only the healing process of the patients, but it's also the community. Is a great community outreach to go out into and find out artists that can help the hospital feel like a part of the community and participant of the community. But art also helps us with wayfinding, and wayfinding is not only is between art, because with artwork we can have icons that tells you that you remember where you are. You might remember, oh, I turned right on the red tree, or the picture of the red tree. You remember that iconic artwork that is placed there. So we combine artwork and wayfinding very much so. And as well, our work could be also on the floor, like the floor patterning here, that's very clearly is guiding you to go to another place through the floor pattern, like the river is walking you through it. But there's been a lot of studies done on the exposure to art, and they have concluded that in the inpatient units, that realistic art is more important because you can relate to it. And contemporary art or modern art, or like we are seeing in here, it is okay to have them in the lobbies, that this doesn't have a shape or form. And in this case, is the Cleveland Clinic. We work on this project. And in here, they were looking for a space that it could be entertaining the adults and children. So it is a virtual, and you go in virtual, and it's an interactive artwork. We also do a lot of interactive artwork in healthcare environments because no one touches them. So in the moments also, the art, one of the benefits that art brings to you, it is that it distracts you. So it lowers your anxiety level, and it can evoke joy. And it can also represent the area where you are from. When we look at our work that we're familiar with, immediately our anxiety level drops down because you feel the place is familiar. Now, our work also, the art also help us with exposure for positive distractions, like if you are in a MRI or a CT scanner, or sometimes a linear accelerator. Those moments are very frightened. You feel very vulnerable. And if we can provide some kind of our work on distraction or biophilia, it will really help the patient to calm down and just have the procedure go through without much stress. So we also found out that, I don't know if you can see this, the graph on the right, lower right, but it is the patient, I don't think, maybe I move it to the other side a little bit. There we go. I'm just gonna move it up a little bit. There we go. Where it is important that the individuals are less vulnerable, which is in the public area. And when you're the most vulnerable, it is when you are in the private areas. And it's simple is that when you are in a procedure room or where you are in a patient room, you have lost control of many things, So it is important that we pay attention to that artwork and that we're putting in every area to help to reduce that stress. One thing that artwork also help us, it is with a clear wayfinding, where we call it also intuitive wayfinding. If how we can define clear pathways to you to go from point A, B, or C, we're really actually not asking anyone for directions. So we combine things from artwork to floor patterns, through lighting, through cues, to give you cues of how to navigate the space and to give you memorable moments that you can remember how to get out of the space. That's as important as how to go into the space that you're trying to go. Acoustical control. Why is acoustical control so important? Well, one is the most probably important thing is patient rest. You need to have a patient that is able to rest at night. You already have beeping things next to you, and even a nurse station is too loud, or people in the hallway are speaking. You need to be able to rest. That's probably the best medicine that we can give any patient, is to rest. And you rest when it's quiet. But also having important control of the noise control, it is to make sure the medication that are being read are being heard appropriately, so you will administer the correct amount. And we do this through a lot of selections, because of infection control, we need to have very hard surfaces so we can clean everything, but the acoustical ceiling tiles help us a great deal to achieve a higher NRC, so we can have a quieter space, a more pleasant space. Now, infection control, or right now how we're calling it, infection prevention. We are doing everything possible and have done it for many years of how to prevent the chain of infection. And in the built environment, it is very important. It is not only about the materiality, but it is about the HVAC systems and the filtration and the amount of air that it comes in and out of the space. However, with materiality, we have to specify always materials that they're non-porous. So nothing is going to go and penetrate, and our floor, especially when we have patients, should be seamless floor, that it could be heat welted, and it could be, it's ideal when we can afford to have the base, the integral base, but they need to be durable, and they need to be also very resilient to the chemicals that now we're using to clean these materials. So we prevent for any bacteria or to grow in here. So we do things also in the details, integral sinks, so we don't have little reveals. So in your case, we try to do as minimum of reveals as possible, and as the cleanest and surfaces and non-porous surfaces. And today, more than ever, this has become very, very important. Now we're moving into creating a memorable experience. How do we, with the built environment, create an experience that it is very positive? The retail industry gets this beautifully. The hospitality industry gets it beautifully. Excuse me. You've seen when you go into a lovely hotel like a Ritz-Carlton or Four Seasons, you know, it's just lovely, and your expectations are also high, because you know somebody's going to take your luggage and somebody's going to treat you like you're special. And you know, but if you go to a lesser hotel, you will carry your luggage for you, and they don't even know who you are. So it's the same thing when we come into healthcare facilities. We need to create a memorable experience, because we come to healthcare facilities when we are in pain, when somebody's suffering, when you know, is not, you don't come to a happy occasion. The only happy occasion that you come is when there is a baby being delivered. The rest is associated with pain or loss. So how do we create memorable experience? We need to create positive first impressions. You only get the chance once, and you get it in the first 3 minutes. So as you walk into the doors in the hospital, what are you going to see? What are you going to feel? What are you going to smell? Those are very important for your senses to realize and develop a sense of space. So we're going to speak about 3 sensory cues, and this is based on Jane Malcolms. She is a researcher and also a designer, and she developed these mechanical cues, functional cues, and the human cues. They're all very different, and when we connect all of these 3 cues, then we have a space that makes everyone feel very comfortable. So the mechanical cues are, for example, the colors. Color is actually very important. I know that maybe 10 years ago, we were designing hospitals that they were very monochromatic. There's just not a lot of color. And we have now realized that color brings joy, color brings vitality, and it makes you feel happy and better. So now we are infusing colors into our environment. In case of this photograph, it is a pediatric hospital. So that's why it's a little bit more playful. But it is important to, you know, a mechanical cue is the color. Is also on the mechanical cue is the sound and the smell. What are you listening to? Every hospital or healthcare facility has a small moment of respite, and it's a spiritual place where someone can go there and be quiet. And it is important because as much as sound, quiet is also very important. Do you hear water? It could be a fountain in the outdoors that you are starting to hear. So those are the mechanical cues that let you know things about the space. And then the functional cues is if you're a patient and you are waiting in the room and they're going to take you to have an x-ray, and they tell you we're going to take you at 2:30 p.m., but it is 5 o'clock and you're still waiting, it feels like you've been waiting there for 2 days because you have nothing to do except to wait. So it is extremely important that everything is timely when you are in the healthcare facility. And especially another very important is medication. I recently have been through a surgery, and believe me, I did one of my medication, not 1 minute late. It had to be on time. So these are the functional cues that it tells you about the environment. Are they on time? Are they being appropriate? And then the most important thing, believe it or not, is the human cues. Um, because there is nothing more than a lovely smile. There's nothing than someone that salutes you and says, how you doing? And the words and the attire that they look professional and clean. So all of these cues give you a sense of elevating the confidence in the place that you are being there to be healed. But then there was also, this also is Jane Malcolm's, she did a huge research of what the patient wants, what is it that the built environment, why is it so important? So in how we lay the patient units, one of the first things that we look is how we can promote a connection to staff. Because when the staff leaves your room, you feel all alone and you think they forgot about you. So it is important that we then design elements that they can feel connected all of the time. Another important thing is your family, that if they're there to be your patient advocate, that they have a comfortable sofa to sleep, perhaps a small refrigerator to put their little bit of the food, that your bathroom is actually adequate and it's lovely whenever you need to take care of yourself and take a shower in a lovely place. And of course, evoking at all times comfort. And if we achieve all of these, then we will reduce the stress and your healing process will start going smoothly. One of the things that we have also found about the built environment, it is the things in evidence-based design that I touch on is noise reduction, minimize negative distractions, and give family accommodations, comfortable seats to wait. Family retreat areas are very important, especially in pediatric facilities, that if you have a child that you have to be there through a special holiday, that perhaps they can all bring a meal and enjoy a meal within the family area, and that they might be able to bake cookies. And then there's nothing more comforting than the smell of cookies. And that always one of the things is very important that everybody complains is to have Wi-Fi connection and charging stations. Those two, we're now adding them everywhere. But what patients really want through the research is that they just want to be heard. They want to be communicated. They want to be informed. They want to speak to them. They want things to be comparable, and they want to have a lovely environment. I'm going to switch a little bit into what we do as designers as selecting materials. And at HKS, we follow the precautionary principle. In a nutshell, we do no harm. And not only on the environment that people are occupying the environment, but also to have a sustainable material selected. And this, I'll go very quick because I'm looking at my time, and in how, just really quick, on how is the life cycle of a product, and we call it a cradle to cradle, and how it starts and how it can become a hazard. And we follow the guidelines from LEED or well design or well building standards, the Living Building Challenge. We're following all of this in order to build environments that they are healthy. And we have asked for transparency on all of the materials. We have found that there are around 5 or 10 chemicals that they are really harmful for us. And for example, I don't know if you've heard about asbestos. Asbestos was a material that it made the materials extremely durable. However, they found after 15 years that it was also very harmful to humans, but it took 20 years for them to demand that asbestos was removed from all finishes. Well, we have found out that there is more chemicals like that invented in a lot of materials. So as designers, we have asked the industry, you need to show us what are the chemicals that they are in your material to make sure that we specify healthy materials. We already, especially in hospitals, have a compromised immune system customer. We now have to also give them something to help them heal, not to make them sicker. And these are some of the, apologies, these are some of the organizations and accreditations that exist right now into how to get certification for clean materials. HKS also developed what is now called mindful materials. We developed it in 2014, and then we have given it to the world, I guess, and now it is a very easy material or a depository that you as designer can go and look whether a material is healthy or not. All the manufacturers need to pre-approve and then prove that all of the materials are healthy. They have a database that is very searchable and is very easy to go. You don't have to pay a fee to belong to the mindful materials. And why is it important? It is because there's so many certifications out there that we needed to put all together so designers will not get confused and have a very much a clarity. And so everyone needs to register through mindful materials of the manufacturer and says whether they're cradle to cradle or their product transparency, emission testing, and so on and go on. And this is basically like a nutrition level. You know how we are now all learning to look at how much sugar it has, how much sodium it has. We're doing the same thing with our materials. How much sulfates it has, how much it doesn't, what is a PVC, how much PVC is there, what harmful it has in the material. So we all look at what is in every material. And now I have a very brief couple of projects that maybe one project that embrace everything I spoke to you about it. So we have a sense of arrival into, this is the Texas Frisco, in Frisco, Texas. And we have, we're getting from the hospitality industry. This is our lobby. And over here is the registration area. But as you can see, it does not look like a hospital, but everything here is cleanable and durable. We even have some geos over here towards the another entrance that again, the energy that the geos bring is beautiful. So, and everything, the inspiration here was about nature. And it's in a biophilic way. You can see the inspiration of the geos in the light fixtures. And we took, this is the one on the left, the lower left. It is based on hospitality industry as well, but it is a hospital. And in the places of the nourishment of the cafeteria. So there's always by the light. We also in the semi-private spaces develop areas like the nurse server is the nurse between two patients. So the patient will feel like there is someone always there. Very clean and visible nurse stations, nourishment centers within the patient unit for family or visitors. Waiting spaces in the unit by natural lighting. The corridor, because of the way it's been treated, is very nice and quiet. And the private spaces, we do have places for the visitors and also a very nice patient room. This is an LDR whenever you have a baby. And then so there could be a little larger crowd, although right now we are not admitting anyone in hospitals. and then our bathrooms and another patient room that we are trying to make it as much hospitably as possible, but as practical as possible. Thank you so much for your time. I know we're gonna address some questions after Angela is done. Thank you.